It's been 5 days since Newark, New Jersey ended a 10-day lockdown to slow the spread of COVID-19. Right now, New Jersey has more than 377,000 confirmed cases and more than 17,000 coronavirus-related deaths. As for the city of Newark, there are more than 18,000 confirmed cases of the virus. 725 people died from the virus as well. Newark's cases make up nearly half of all cases in Essex County. Joining me now is Newark's Mayor Ras Baraka. Mayor Baraka, thank you so much for joining us. Back in March, you locked down pretty early and managed to get the positive infection rate down from 68% to just 2% in your city. So what obstacles did the city face back in March that may have changed over the last 9 months?
Well, I think the only thing that has possibly changed is just the fatigue of being following the COVID rules and guidelines, keeping people in the house. We were basically on a stay-at-home order for about 4 months here in the city, and the governor began opening things up. Restaurants, gyms, barbershops, beauty parlors began opening up. So we assumed that we would begin to see some uptick. Obviously, it is larger than we hoped for, and so we have to respond to that.
And Mayor Baraka, your city just ended its Thanksgiving lockdown last Friday. During those 10 days, did your city see the drop in cases and hospitalizations that you hoped for?
Well, it's hard to tell in the 10 days that's happening because you have to actually look at the weeks after that to see if there has been an impact. Obviously, people that are getting tested in that 10-day period were probably infected before then. And so the real results will happen in a couple of weeks later. But I do see that because of the Thanksgiving holiday, people have gone out of town, was with their family, and as they got tested, the numbers were increasing based on them leaving town. And I think more than anything, us not allowing those people to go out and be at restaurants and be in public places kind of, curbed the tide from it spreading even more than it would. But we did see a slight drop during that time period, but it is that drop cannot be attributed to the 10-day lockdown.
Right. It's so tough when people are fatigued. Now, Mayor, when you first announced the lockdown, you stated during a press conference you were getting pushback, and you even said this about the need to contain the virus. Let's listen.
If I don't get elected tomorrow because of what we do in Newark, then I don't care. And that's really how I feel about it. At this point in this thing, my family lives here. My friends live here. 6 police officers have died. And then you want to argue with me about whether your business should stay open 2 additional hours? We close you at 8, you're mad because we're closing you down 2 hours more than the governor at 10? I think it's selfish.
So, Mayor, your term is up in about a year. Your concern is clearly, though, for the residents of your city. Are you still willing to enforce lockdowns if the city doesn't get the virus under control?
Sure. I mean, I'm glad that we are not in this kind of public fight with the governor. I mean, I think that he's been doing the best that he could in this situation. I always tell people I'm glad I'm not in Georgia or Florida. At least I have a governor that agrees with science. But at the end of the day, what's happening in Newark is not happening all over the state. So we need special a kind of a treatment here in the city of Newark. And prayerfully, the governor gives us the support that we need in order to do what we need to do. And if the governor shuts down the entire state, then we're supportive of that here in Newark.
And speaking of support, your city launched a grant program to help small businesses back in March. How successful has that program been? And do you plan to continue it if another lockdown needs to be put in place?
Sure. We are already putting forward our third kind of tranche of money for businesses and folks that are behind on their rent. That application will be available December 14th for all businesses and throughout the city. And we're making a special focus on barbershops, beauty parlors, nail salons, clothing stores, the businesses that obviously can't do takeout or pick up at the curb, all these other things. We want to give them the opportunity to have a chance to get some relief during this time. We closed them for 10 days, and those folks that participated and helped us out, we want to help them out.
You mentioned a little bit the support you're getting from Governor Murphy, even though there have been some, I don't want to say misunderstandings, but maybe they are misunderstandings. But what has been the response from the federal government? Have you gotten any help from the feds?
Oh, no, I wouldn't say directly. I mean, obviously, the money that they've given people around stimulus checks, if any of our businesses got PPP, wow, we were lucky. And then some of the entitlement dollars that we are getting, that we normally get, that they allow us to use for what we're using it for, businesses that are in distress, to help pay people's rent, all of those things, relaxing some of the restrictions to allow us to do that, has been helpful for us here in the city of Newark. We obviously need more resources and more opportunity. More importantly, we just need a national direction to help us facilitate coming out of this pandemic.
And Mayor, 85% of Newark's population is African American and Latinx. We know that this virus is disproportionately killing those two communities. Do you have a plan in place that specifically targets communities of color?
Yeah, I mean, obviously, in all of what we do, you say 85%, everything that we do, that's why we do a little more than what the state does, right? That's why we try to advance what the state does just a little step further, because we believe if we did everything the same, then the results would be different. And so we have to be more restrictive. We have to close a little earlier. We have to put curfews in place. We have to ask people to do just a little more than what the state is demanding, because our risk level is higher than the rest of the state, than the rest of the county, in fact.
And Mayor, there's a long history of distrust in many African American communities when it comes to vaccines. Are you planning to encourage people of color in your own community to take the vaccine when it comes out?
Yeah, and rightfully so. I think people are smart to have some kind of trepidation around what's going on, with the vaccine. If they are astute in terms of history, they understand that, they should pay attention to it. What we are doing, however, is making sure that we have as many community meetings as possible. We've already had two, one that we did and one that University Hospital did with infectious disease experts, doctors and scientists talking to the community about both vaccines and about the side effects, the ingredients, the other things that they should expect from this. So we're going to do a robust educational campaign. I'm going to take the vaccine myself, as long as I'm healthy, I'm alive, I'm well, I think it'll have a great impact on our community. And we're going to continue to push, because we're in a rock and a hard place. We're dying the first, and we're the least likely to take the vaccine. So we have to meet somewhere in the middle here.
All right. Well, Newark Mayor Ras Baraka, thank you so much for joining us. We really appreciate your time.
Thank you for having me.